In this video, we examine the use of vitamin D during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. For all the talk of vitamin D fighting cancer, you'd think it would do more. There is a plethora of cell line evidence that vitamin D acts against cancer, as well as numerous observational studies showing that healthy levels of vitamin D can help prevent cancer. For instance, one study suggested that high levels of vitamin D could reduce colon cancer incidence by 50%. Although it's true that high normal vitamin D levels are associated with lower incidence of cancer and better survival upon diagnosis, vitamin D is actually affected by many factors, including eating habits, obesity, and time spent engaged in activity outside, which could also affect melatonin levels, etc. So we don't know whether it's the vitamin D or the other factors that are having the positive effect. The aforementioned colon cancer study simply correlated vitamin D levels with cancer incidence. When an actual placebo-controlled trial involving 26,000 people studied the effects of daily vitamin D supplementation, it did not find a significant reduction in the incidence of cancer over placebo, 1.1% versus 1.4%. The way to truly discern the effect of vitamin D supplementation's effects during cancer treatment is to conduct randomized controlled trials where two highly similar groups are taken and one is given vitamin D and one is not. These trials have been performed, and like in the trial examining vitamin D's impact on cancer incidence, the outcomes on survival minorly favor vitamin D, but only minorly. One meta-analysis summarized 21 trials regarding vitamin D supplementation during cancer treatment and concluded there was some evidence that the use of VDS, vitamin D supplementation, in cancer patients could improve cancer survival, but no significant effect was found in population RCT's randomized controlled trials. Probably the most favorable RCT for vitamin D was the Amaterasu trial in digestive tract from the esophagus to rectum cancer, in which vitamin D supplementation showed a 5-year relapse-free survival rate of 77%, while placebo showed 69%. The difference was not significant. The majority of other RCTs have not shown significant benefits either. For instance, another placebo-controlled trial that took place after the aforementioned meta-analysis found that vitamin D supplementation conferred no survival advantage in stage 2 melanoma patients over the course of 5 years. Still, any kind of survival advantage is appreciated and should be pursued, even if it is nowhere near as beneficial as any supplement profiled in our videos. Vitamin D levels in the 50 to 80 nanogram per milliliter range seem to be sufficient, although there is no agreed upon ideal range. People of color will need to supplement with higher doses of vitamin D as they synthesize less from the sun. As many as 80% of cancer patients have insufficient vitamin D levels. Supplementation can correct this. For more information about vitamin D, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.